If you're immunosuppressed, you need to be worried about the Hanta virus outbreak. I'm Dr. Zara Kazmi, double board certified rheumatologist, and I discuss viruses with my patients every day. The Hanta virus outbreak, particularly the Andes strain that has happened on a cruise ship recently, is concerning for a few reasons, especially for the immunocompromised patients. Number one, the Hanta virus, if infects patients, has a very high mortality rate, close to about 40%. But it is important to know that there are no good studies that show what is the mortality rate in immunocompromised patients. The case reports that we have from patients who underwent transplant and then acquired hantavirus show much higher mortality and involvement in atypical organs, such as the brain involvement with hantavirus, which is not very common otherwise. Number two, the important thing is testing when it comes to outbreaks, and patients who are immunocompromised might not test positive for hantavirus, IgG, and IgM. And for that reason, a PCR will be necessary. And we know at this point from COVID that PCR turnaround time is much longer. So getting properly diagnosed and treated may be a bigger concern for patients who are immunocompromised. The public guidance that is being provided right now is notifying that you need prolonged exposure to acquire this transmittable virus. However, this is for the general population and has not been studied for immunocompromised patients. So that is another reason why we need to be careful. The most data that we have right now for the hantavirus is when there is direct transmission from animals and rodents, and not a lot of data for human to human transmission, such as in the Andes strain. So my advice to immunocompromised patients would be to be extremely vigilant, avoid unnecessary travel, particularly air travel, and take all those measures that you were taking around COVID times, such as wearing a mask, hand sanitization, and avoiding unnecessary contact and social distancing. It's always better to be safe than sorry. If you found this helpful, follow me for more rheumatology content.